Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world. From border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut to the fog that exists at the leading edge of healthcare technology and processes. I'm very pleased today. I've got a return guest, Mr. Hal Wolf. Hal's the president and CEO of the Healthcare Information and Management System Society, better known as HIMSS. Hal has over 30 years of experience in the healthcare domain and has expertise in areas as mobile health, product development, distribution, all kinds of information technology. He has helped health systems and providers across the world with end-to-end solutions, data, and architectural design. So, Hal, once again, this will be Chapter 2. Welcome to the Tate Chronicles.
Jim, thank you for having me. It's great to be back.
Hal, the last time we spoke, I guess, was right at the earliest days of the COVID-19 epidemic. It was shortly after the cancellation of HIMSS 20 due to the public health emergency. At that time, it seemed like we were in an acute national emergency. Now, about 5 months later, it seems like we are in a chronic emergency, almost without end. I'm looking forward to your thoughts, as well as the direction HIMSS is moving in this new world. And so, if you don't mind, I'll just jump in with some things I've been curious about in terms of what HIMSS is doing. In particular, how I know that HIMSS 2021 was scheduled for spring of 2021, but you decided to move it into August 2021. What were the reasons behind that movement? Usually it's in the spring, but going into the summer.
Well, Jim, again, just an absolute pleasure to be here. Really, one word: safety. You know, when we really were looking at the epidemic, and you labeled it appropriate. At the time that HIMSS 20 was canceled, it was a week later before it became a pandemic, right? And we have been still continuing to work with epidemiologists and the health community around us that we all serve, and listening very carefully to the progress that has been made in terms of how we care for individuals with COVID-19, and our success rates have gotten much better. And of course, an absolute tip of the hat to the heroes. And then also looking at the development of vaccines. And there's just a fundamental view. And we started looking at this 4 months ago, and in earnest 3 months ago, and it takes that long to move a HIMSS. This is not an easy thing to do. To look at an alternative date that was later in the year. And the reason for that was we want to be able to get back together again as close to normal, whatever that may be. And I think we're all wondering what the new normal will be. But we're hopeful that the vaccines and the care in the country and the status of the United States will give us a chance to get back together again in August. And those additional 5 months to us felt very critical, and to all the advisors around us. So we're super excited about it. It's going to be in Las Vegas, August 9th through the 13th. Everyone who had registration for HIMSS 20 had their registration transferred to HIMSS 21. And we're just looking forward to what we think is going to be a heck of a joyous celebration. I think everyone is so excited at the prospects and the hope of getting back together again.
You know, just taking a step back just to view what we've been through, Hal. Looking back at in March and April, and there was all the discussion that we were in wave 2, and when the hot weather came, COVID-19 would be suppressed somewhat, and then there would possibly be a wave 2 in the fall. And I don't think we ever got beyond wave 1. It seemed like a plateau at a very high level. And the issue you brought up of a vaccine, that's looking like so necessary for everything to get back together and back online.
Yeah, I agree 100%, Jim. You know, this is not the flu. This is in the flu family, as we say. We are learning and continue to learn what this virus does and how it does. does it. It's not going away with hot weather. Wishful thinking isn't going to make it happen. And everywhere in the world that has had it, it hasn't actually been completely snuffed out. And the United States is a trouble spot from time to time, as we know. And going into lockdown and doing all the things we have to do from a discipline standpoint is not ingrained in the personality of the country, and we're paying the price for it. But I think that in the end, a vaccine, and there will be different types of vaccines, and we don't even know what vaccine will be coming forth, whether it will be a one-time vaccine, a 3-month vaccine, different vaccines for different segments of our society. And so it's fantastic that the government and so many of the researchers around the globe are getting the funding they need to really figure out the different approaches. But people are very hopeful. I think we're hopeful as well. Dr. Fauci said recently that he was, quote, cautiously optimistic. And that was for the end of the year and the beginning of the first quarter. Finding the vaccine is stage one. The second is, how do I roll it out, right? How do we get it into the hands or into the veins or into the people that need it most? And in the society basis, it'll be hierarchical. We understand who's most vulnerable in our populations. We also know that the provider community is going to be very high on the list because so many of our heroes have been infected. But it has really been a transitional moment for us as a country, and we're very optimistic, or hopeful, I should say, that by August, which is a full year from now, literally, we'll be celebrating together in Las Vegas.
I hope to be there with you, Hal. Let's, if you don't mind, go back and kind of examine some of the issues related to the cancellation of HIMSS 20. Leading up to that, it seemed like, maybe even in January or February, the chances of the cancellation of HIMSS and what that entailed were about on par of thinking you could cancel college football. Well, here we are, and college football is being canceled. I mean, talk about once in a lifetime thing. This is not once in 10 years. It's really, to me, that's just an example of what is normal everyday living has been affected by this. And so the types of inventions and interactions HIMSS had to do related to the relationship between vendors and exhibitors who were coming to HIMSS 20. And there probably was a lot of static, for lack of a better word, based on contracts and figuring out how to take care of those vendors and exhibitors and people and registrants going forward.
Yes.
There's probably some complications around insurance and stuff like that. If you don't mind, I'd be curious to hear how all that has worked out and is still being worked out.
Yeah, thank you. Yeah, I will tell you that it's one of the more complicated and complex challenges I've ever had, for sure. We had the good fortune of having insurance with communicable disease, a rider on our insurance, but we saw the risk to the healthcare population very early. And by early, meaning in February. And we began monitoring it in mid-February, and the numbers looked pretty good. It did look like a regular flu, everything we were seeing. And then, as you know, a week before, we suddenly were faced with completely different numbers by the CDC, by the WHO, infection rates, death rates. And of course, that's when we realized that a decision had truly been made for us in terms of canceling 20. The contracts were difficult because the agreements that had been there for many, many years had force majeure language in it, which was basically leaned all the way in towards HIMSS. And it put us in a very precarious position of not being able to grant remedies back to the market suppliers the way that we would like to, because it would take certainly more cash than we had on hand. We had bills that had piled up getting ready for the event. We rented facilities like the facilities in Orlando, the convention center, all of the things that go with those. And we were stuck because you can't get ahead of your insurance organization. And because we had pulled the trigger before it was officially named a pandemic, we had concerns as to how they would react. They have reacted favorably. It has taken a long time to get to an end state of a settlement. But what we did in the meantime is we reached out, we took what we had available to us, and we committed $7 million in remedies, which at that time was 25% credit, split between 21 and 22, because we knew at the worst case scenario, we could dip into our pocket that far and still remain viable and productive in our mission, which people count on from a thought leadership standpoint, training, workforce development, our government relations programs, all the things that people really join HIMSS to do, along with getting together and sharing best practices and all the incredible things that we do at a global conference and our other conferences as well. So we've been in a waiting game with our insurer. We're in the final processes now of settlement and inevitably payment to HIMSS. And we are really looking forward to going back to the market suppliers who, by the way, have been incredibly patient, and they have been very supportive. And I understand their frustration. I have spoken with many CEOs across the aisle, from small to startup, all the way to what we would call our anchors at the conference itself. And the vast, vast majority of them have been incredibly supportive. And we will be coming forward with additional remedies that we simply weren't able to do before. And as soon as we are settled and we understand the status and the delivery of funds and the full range that we can afford, we will take it as far as we possibly can and really look forward to getting everyone back on track. And the great news is that the signups for HIMSS 21, which have restarted, really have been terrific. And again, just highly supportive of the industry. And we thank them.
One thing that I've noticed is that since the date of HIMSS 20, there seems to be, I don't want to say a complete metamorphosis of HIMSS, because the underlying mission of education and bringing folks together and research and all those kind of things is still in place. But there seems like there's been a move towards some type of additional electronic platforms. I read recently about something called HIMSS 365. What is HIMSS 365?
Well, thank you for asking on it. Now, I'm going to get it. I got in trouble a little bit just because I was calling 365.
Yeah, I like
which is
that.
Really, I like it too, but I'm going to have to talk to marketing about it, right?
Okay.
But really what it is our working title. So I'll take you back.
Okay.
When we canceled the global conference, we had all of this demand and energy to bring presentations, all the incredible work. I mean, the hundreds of presentations that our members had ready to share with each other, presentations by market suppliers. This is what was teed up for Orlando. So how did we bring it forward? Well, we really took the infrastructure we had, like many people, and I think what HIMSS has been through, by the way, is a huge reflection of the industry itself and the whole ecosystem. We went to what we would call telehealth, right, if we were on the provider side.
Sure.
We began using our infrastructure on HIMSS.org and our learning center to put up webinars. We started a whole new set of webinars and presentations devoted to COVID-19. Thousands and thousands of people pouring in. And we recognized that even though we had tens of thousands of people whose badges were now forwarded to 20, which is great because everyone who had a badge for 20 is now all set for 21. And we transferred all of that for them, which was a part of the agreement, of course, and it's been there for years. But we sat back and we said, we need to bring this forward. We need to go virtual. So we started doing it, and we really learned a lot. We learned a lot about what people were interested in seeing, and we recognized, the The crescendo, if you would, of the HIMSS experience has been in the global conference, no different than an encounter with your physician. How do we bring this to them 365 days out of the year? How do we create the personal experience and the value of a HIMSS membership 365 days out of the year? So we have been working on what we call internally HIMSS 365. I'm sure that marketing will come up with a snappier name. But really what it is our dedication to bringing the full HIMSS experience 365 days a year to our members. And not only in a shotgun approach, but we've been putting in a very strong back end, which will allow us to curate to the individual member the types of services and educational opportunities and thought leadership, certification programs that are of interest to them. So we're really, and what we want to do is take all of the special pieces that make being a HIMSS member and the value proposition of being a member everywhere from our chapters all the way through to the global conference, and be able to bring it to the individual the way that they want to see it 365 days out of the year.
Wow.
So we're very excited at the approach of HIMSS 365. We have been putting a lot of money into our back end to rebuild it. We're very pleased with the hard work that went into what we learned out of the global conference and having to take all that amazing content and put it onto our current infrastructure. But the personalization at the membership level that's coming forward, we have big plans. And we're looking forward to launching it in the spring and have it up and running full speed by the time conference comes along. So if you're at the conference, you'll have the benefit of the HIMSS digital experience. If you can't make it, there'll be ways to participate externally. And we're really looking forward to bringing it forward to make it an exciting journey 365 days out of the year.
I'm looking forward to the full launch of that. You know, one of the things that I've become increasingly aware of, and maybe it's been around a while, but these channels that HIMSS has, these news channels, there's HIMSS News and Healthcare IT News and HIMSS TV and Healthcare Finance News and news around mobile health. And to be able to put that together and have teams on top of that information, because things happen so quickly when there's a merger acquisition, or if the president signs a new executive order that affects telehealth, you've got to get people ready to assess that, put it online, give commentary, and publish it. I find that very helpful. And I don't know if that's newer or there's just increased emphasis in those kind of news channels that the HIMSS is cranking out.
Yeah, well, you know, the infrastructure's been there, and of course, a number of them have been around, but we are definitely using them differently. We shifted over the last 3 years, and the last of our physical publications went away, the paper, if you would. They would show up, and we've gone to, of course, a full digital capability. And what you're really seeing is this use of digital technology and the use of digital media more effectively by the organization. We've always had an amazing editorial team and capability to gather the information, but how we go about publishing it and the speed in which we do it and the coordination of our content have actually changed quite a bit. So actually every week we have content meetings, government relations, our media group, the different publications are represented, our international folks are there. We have conversations about what is coming up, what is the value to our members, what are the stories that we think will be breaking. And we really talk about the prioritization of the ecosystem as a whole so that we're prepared to bring forward, including social media, where we've gotten far more sophisticated, and the relevancy of it right to the health ecosystem as soon as it's breaking, and also with some anticipation. At the same time, we're working behind the scenes, if you would, to somewhat help create the news. And what I mean by that is really focusing on our government relations team. They have done a spectacular job. They were right at the forefront, as an example, on our public health infrastructure and data modernization effort of $500 million heading into the CDC and the states to shore up the back-end infrastructure for population health. We've been working very hard on patient identification, which passed the House, and really getting the bans out of the way for HHS to use funding, and the development of unique patient identifiers and a national patient identification strategy. These are reflections of the needs of our members and the organizational affiliates, meaning the providers that are part of HIMSS. We get very consistent feedback about what they need. And most recently with the pandemic, we're working very hard in the background to make sure that the gains that have been made by telehealth, the reimbursement, a number of the barriers that have been inside this country that have been taken down to deal with the pandemic don't go away afterwards. So the actions that are sitting behind us in literally HR 7663, which is protecting access to post-COVID-19 telehealth act, we've been supporting that and really pushing hard that the rural health clinics and federally qualified health centers, the RHCs and the FQHCs, can maintain distant site telehealth services and benefits through Medicare. This is important. We don't want to go backwards. So HIMSS is working super hard, if you would, to help push the industry forward and support it, and then cover it to make sure that everyone understands what's occurring.
Kind of talking somewhat there, Hal, about the legislation that's starting to fill up the pipeline around making permanent some of the telehealth temporary things that were put in place as far as use cases and reimbursement. I took a look the other day, and I'm amazed at how many bills are before both the House and Senate to kind of gather data to make sure that use cases are appropriate, that telehealth is being expanded where it really does good. And it's been quite a thing to watch. And beyond, of course, as a part of telehealth, but because of the epidemic, we think of a provider talking to a patient. But the telehealth part that has to do with remote patient monitoring, people have gotten, in the provider world, have gotten so comfortable with telehealth, episodic telehealth encounters, that I think that's really going to push forward the remote patient monitoring. And technology's been there. It just hasn't been as widespread as it could be. There may be some silver linings in there around the adoption.
Couldn't agree more.
Yeah,
couldn't agree more.
Yeah, I'm curious about the HIMSS organization, Hal. Many large organizations, corporations, companies had to very quickly adapt their own virtual mode to communicate among staff and hold meetings and work from home. Were y'all already doing a lot of that at HIMSS, and has that been accelerated? Did you have to come up to speed quickly, or had you already been doing virtual meetings?
Well, we had a work from home policy at HIMSS for quite a while, and about 60% of our staff was working from home prior to COVID-19. Now, the reason for that is that we're not a large organization, but we are global and we cover a lot of ground, and our staff works extraordinarily hard to cover as much ground and do as much as they do. And if we opened an office where everyone worked, we wouldn't have a dime. So it's always been very important for us as a nonprofit to get the best people we can and let them work to their maximum efficiency where they are. So we've always had a work from home policy. When COVID-19 hit, like every organization, we shut down our offices and they remain closed at this time. And we went to full 100% work from home. And our IT department did an astounding job of getting laptops out and all the tools that were needed. We're using monitoring, we're using online services, WebEx, Zoom, combinations thereof. We've been using Slack. We've been using all the tools that everyone uses to stay in contact with each other. And we've been making those adjustments, Jim. You know, want to give you an example. We had a board meeting about a month ago. And, you know, in our traditional setting, we would have sat in a room together for about 8 hours. And we adjusted because, you know, if you're sitting on a video call for 8 hours, it's not going to work. So we literally split it up over 3 days. And we did 3 3-hour sessions. And it allowed people to work when they weren't on the board meeting. It allowed tremendous focus. And it was a great example of something we never would have tried.
Exactly.
If the pandemic hadn't happened, and I have to tell you, it worked extremely well. Now, we all look forward to getting back together again. Again, that's just a human condition. But we're very excited about it, and we will wind up, I'm sure, of course, reopening offices. But when we're doing so, and I just had this conversation yesterday with our CFO, we may go to a smaller footprint, and people will hotel more rather than have permanent offices and allow them to work from home. We just had more surveys done internally amongst the 360 people that make up HIMSS. And there's no question that there's an overwhelming desire for many to have sort of a split environment of working from home, say 3 days a week and in the office 2, or, you know, the other way around.
Sure.
So adjusting.
Well, it's fascinating. Just as healthcare delivery has been affected, the way that businesses involved in healthcare are kind of being swept along with the same tide. It's hard to believe, Hal, but our time has almost totally gone away with us today. I'd like to thank our audience for joining us on this episode of Tate Chronicles. I offer a special salute to my guest today, Mr. Hal Wolf of HIMSS. Hal, thanks for coming aboard today.
Great hearing you, Jim. Thank you for having me.
You can find more information on this show's program page at healthcarenowradio.com. And until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.